Hi, my name is Trish O'Gorman. I am a registered nurse and I'm a yoga teacher. And I wanted to talk to you today about some self-help for the body and emotionally that can help during this time with this coronavirus pandemic. So even if you have no signs or symptoms of disease, there's things you can do to really maintain your health, especially your lung health. And I'm going to talk to you about that today. There are certain breathing techniques and simple movements that can really help you keep healthy lungs, keep your lung capacity at its greatest, keep the air flowing freely, and really optimize lung health, right? So there's a lot you can do, and these are good things to know at any point because they just maintain health, and it's just so important in managing stress and anxiety also. And if you have signs or symptoms of COVID, you may, it's starting seemingly with sneezing, sore throat, high fevers, things like that. And those are generally manageable symptoms, but if it moves into your lungs, that's when people are finding it pretty difficult and having a hard time. And most people who end up hospitalized are being hospitalized because of breathing difficulties. So these are really important techniques at this point in time. As a yoga teacher, I've been teaching them for 15 years or so. And I think it's just good to have a toolkit that you can go to really help yourself at the onset of any kind of sickness. But also if ahead of time, like I said, to help manage stress and anxiety. Because when we are anxious, our breathing gets very shallow. And I'm going to really encourage you through the use of these techniques to breathe very deeply into the lowest part of your lungs, because that's where the actual exchange of gases happens. It's deep down in the lowest parts of the lungs that the alveoli sacs are, and that's where the exchange of gases occurs. And also the pure mechanics of expanding and contracting your lungs is going to help release mucus and help clear mucus, and you don't want it to sit and get thick and goopy and then you're in trouble. So, and also if you are feverish and you have signs of COVID and you don't feel well, this is not going to be easy, because one of the problems or the issues is that disease wipes you out. It makes you tired. You just want to lie down. But unfortunately, lying on your back for long periods of time isn't really one of the worst things you can do, because it allows for all that pooling of fluids and mucus in your lungs. It allows it to build up. And also when you're lying on your back, you're really not able to expand your lungs into your back, where a lot of the exchange of gases happens, right? So, I would really encourage you to move even just a few times through the day. Just maybe set a timer every hour, every couple of hours, you're going to sit up and do these simple exercises. But like I said, they're good to know. They're good for everybody at any point, because they can relieve anxiety and they can just give you tools. So let me show you what they are. The first thing we're going to do is you're going to really kind of begin to open your rib cage. Of course, your rib cage and your shoulders, everything is connected in the arms. So the very first exercise, I want you to interlace your fingers, and you're going to take your arms up overhead. You're going to inhale deeply and stretch it up really high. Stretch up high and exhale and bend your elbows a little, take the arms down and just go to your body's capacity, whatever that is, okay? You're going to inhale, reach up. Most important part to focus on is here your lungs and your ribs, not your arms. Exhale, relax down, bend the elbows a little. One last time. Inhale, stretch up. And exhale and release the arms. Good. Turn your hands down and just rest them on your head very gently. Very gently. In fact, lift your head up into your hands. Good. And you're going to inhale as you just turn to the left. Exhale as you turn to the right. Again, it's just go to your body's, go with your body. Don't push anything, don't force anything. You're just gently turning a little side to side. Inhaling left, exhaling right. You could move slowly or quickly, whatever feels good for you, but you're trying to move your ribs a little. Come back to center. And then the last little movement here is you're going to, again, find your rib cage, and you're just going to roll it in one direction. Roll your ribs, again, like you can massage your lungs, as if you can really get in there. Good. And then change direction. And breathe as you do this, maybe inhaling forward, exhaling as you scoop and round back. Just do a few more. Inhaling forward, exhaling back. Good. Inhale deeply to center. And exhale, relax. Take your hands down. Good. Bring one hand onto your belly and the other hand onto your chest. Right? Take a big breath in. Mouth or nose, it doesn't really matter. And breathe out. Good. The goal for this exercise is to really try to breathe with your belly. So right now, put both hands onto your belly. And as you breathe in, breathe as if you're only breathing with your belly. You want to breathe in. Let the belly rise. And as you breathe out, pull the belly back in towards your spines, pushing all the air out, all the air, all the air, all the air out. And then relax your belly, let it rise as you inhale deeply. And again, exhale all the way out, pulling the belly in. Good, keep going, push, push, push. Inhale deeply as you fill your lungs. Exhale all the way out. The next time you're going to inhale very deeply. Fill your lungs, hold your breath. Count to 5. Exhale all the way out. Let's do that again. Inhale deeply, fill your lungs. Hold your breath. Count to 5. Exhale all the way out. One last time. Inhale deeply, fill your lungs. Hold your breath. Exhale all the way out. Good. And relax. So you can do that, 5-10 times if you're comfortable. It's really going to help. If you have signs of active disease, active COVID-19 in your body, the last couple of times you might want to actually, when you exhale, cough a little, just to begin to move some of that mucus. Of course, you'll cover your mouth, cough into your sweater, whatever you need to do. But that can also be an effective thing to do. If you don't have any signs of the disease, just do this maybe morning and evening, just to slow and deepen your breath, to stay calm, to keep your body healthy. So that's it. Thank you for your time, and take care. Be well, everybody. Thanks.